name is Emilie Parent. I'm one of the radiologists at the Small Animal Hospital, and I'm going to help you going through how we could determine if there's any metastatic spread to this patient who we suspect has a splenic hemangiosarcoma. So diagnostic imaging helps you to determine the presence of gross metastatic disease. This is to determine if surgery is appropriate for your patient. We're going to look predominantly at the liver through an imaging, an abdominal ultrasound. You're going to look for any focal nodules or masses that could potentially lead to a metastatic spread from the splenic hemangiosarcoma. You might also want to determine if there's any adjacent abdominal organ involvement or any spread to the peritoneum itself in case of sarcomatosis. An abdominal ultrasound is going to help you to do that. If you're not confident with your skills performing abdominal ultrasound, you might want to ask for a peripatetic ultrasonographer or refer it for a full abdominal scan. Then your next step is going to be thoracic radiographs for pulmonary metastatic disease. Through that, you would like to do at least 2 views, but it's better to do 3. Both laterals, right and left, and a dorsal ventral view. This is to maximize your chance to see a small soft tissue nodule within the lungs. The limit for detection of metastasis in lungs on radiograph is determined to be around 7 to 9 millimeters. So you'll need the nodule to be over 7 millimeters to try to be able to see it. On the radiograph that I'm showing, the pulmonary nodules are quite obvious because they are large, but a subtle small nodule might be difficult to find. And that is when you might wonder, is CT better? Yes, doing a CT chest is better to detect pulmonary metastasis because the limit of detection for CT to detect those nodules is 1 millimeter, which is much lower than what you can get with the thoracic X-rays. As an example, you've got an image here where you've got 4 small nodules, and those ones might be undetected on X-rays. As a final chest ultrasound, you might want to determine if there's any pericardial effusion. That is because metastasis can go to the right atrium typically and then create a nodule or a mass that tends to bleed. And doing T-fasts might help you determine if there's pericardial effusion. At this point, if there is pericardial effusion, you might be able to see a nodule at the right atrium. If there's no fluid, then it tends to be very difficult unless you're very skilled. Remember, we cannot detect a microscopic disease. So it means that what we can do with ultrasound and thoracic X-rays or CT is only to say, I cannot see any nodules at this stage, but you cannot tell if there's microscopic metastasis already, which means the surgery is not the cure. If you decide to go further with surgery, you might want to perform a splenectomy, and that's what you're going to see in the next video.